Assalamu alaikum. How are you folks? Today we are going to discuss about the nerve palsies of the extraocular muscles of the eye. There are three nerves of the extraocular muscles of the eye. The third nerve, oculomotor nerve, fourth nerve, that's the trochlear nerve, and the sixth nerve, that is the abducent nerve. Let's first discuss about the third nerve, that is the oculomotor nerve. The oculomotor nerve innervates four muscles, that is the superior rectus, inferior rectus, the medial rectus, and the inferior oblique. Now, if the third nerve is paralyzed due to any lesion, any abnormality, any disease, what do you think will happen? The eye will deviate downward and laterally. Downward and laterally. Now, why is that? See, the third nerve innervates the medial, superior, inferior rectus, and the inferior oblique. When these muscles are paralyzed, there is unopposed action of the superior oblique muscle and the lateral rectus muscle, because the superior oblique is innervated by a trochlear nerve and the lateral rectus is innervated by the abducent nerve. The lateral rectus will pull the eye on the lateral side of the eye. The lateral rectus will pull the eye toward the lateral side, and the superior oblique has three functions: encyclotorsion, depression, and abduction. But if we combine these three functions of superior oblique, it results in the downward and lateral position of the eye. So these two muscles will result in the downward and lateral deviation of the eye. Apart from that, there will be ptosis of the eye, because the third nerve also innervates the late levator palpebrae superioris. So there will be no elevation of the eyelid, that will result in ptosis as well. Let's come to the fourth nerve, that is the trochlear nerve. The trochlear nerve, as we discussed, it innervates the superior oblique muscle. Now, if the superior oblique muscle is paralyzed, this will result in the unopposed action of the inferior oblique. The inferior oblique causes excyclotorsion. Excyclotorsion means that the inferior oblique will result in the upward and inward position of the eye. This will causes up and in eye. In simple words, we say the eye will be upwards and inwards. Let's come to the last nerve palsy, that is the abducent nerve palsy. Now, the abducent nerve innervates the lateral rectus muscle. Now, if there's a lesion in this nerve, this will result in the unopposed action of the medial rectus muscle. This will cause the inward deviation of the eye. Let's say if my right eye has a lesion of the abducent nerve, my medial rectus will have unopposed action, and the right eye will be deviated medially. I hope you folks have understood to some extent the main functions, the lesions, and the reason behind the position that is taken by the eye in such lesions. If there are any more questions, please leave it in the comment box. I'll be sure to read it and answer you folks. Until my next video, take care folks.